Hello from the Carpal Tunnel Clinic. Let's go through the basics so you have a good understanding of this minimally invasive procedure so you are ready to sign your consent form. The carpal tunnel is a narrow passageway on the palm side of your wrist. It's formed by wrist bones and a strong band of tissue called the transverse carpal ligament, creating a tunnel-like space where important structures pass through, including nerves and tendons. The carpal tunnel release is performed using a very small device, the Dionex Ictisura 2 micro knife or the iBlade, a small needle-sized instrument with a hook blade. This technology is used alongside guided ultrasound to precisely cut through the carpal ligament that is pressing on your median nerve, causing your symptoms. The tip of the knife is blunt and the blade is inside of the blunt curvature, enabling safety and accuracy. With ultrasound technology, your doctor can see all the important structures inside your wrist. After local anesthetic infiltration, the device is positioned underneath the carpal ligament and is gently retracted, releasing the ligament. A dressing is applied with no stitches required. As you can see, 3 months after the procedure, the scar is barely noticeable as the entrance to the carpal tunnel was made through a needle, leaving barely any scarring on your hand or wrist. It is important, though, to acknowledge that although this procedure is minimally invasive, there are risks involved. I will list them on this slide and we will go through them in detail. Infection, although very uncommon, is a very important complication of any procedure. It presents initially with non-resolving pain, usually mild pain that progresses to severe pain, swelling, and redness. If the infection is superficial in the skin, it is relatively benign and resolves with oral antibiotics. If the infection is deep in the wrist, it will require a washout of your wrist done in emergency with intravenous antibiotics. The risk of infection in the Australian population is less than 1%. This data is done with the full open release, and we believe that with our technique, the incidence could be lower. Non-relief of symptoms. This could happen due to multiple factors such as arthritis, ulnar nerve symptoms, chronic inflammation of your tendons, inflammation of the fascia, which is the thick band that covers internal wrist structures, autoimmune diseases that cause wrist pain, and the unforeseen cause which sometimes doctors cannot explain. When people have carpal tunnel syndrome for many years, some of the fibers of the median nerve can become permanently damaged. That means that the release of the ligament that is pressing on it will not make much of a difference, as the damage is not reversible. A temporary increase in numbness without nerve damage from the procedure is not uncommon. The local anesthetic injected in the carpal tunnel and the associated swelling after the procedure can cause temporary compression of the nerve. That will cause temporary numbness and pain that will resolve with elevation and rest. Permanent numbness can be caused by damage of the median nerve or one of its branches during the procedure. It is extremely rare. It can occur if your anatomy is very different from other people's, but most of the time it can be identified on ultrasound. The recurrent motor branch of the median nerve is crucial for thumb movement. During carpal tunnel release surgery, the nerve's location can vary, which might lead to unintended injury. Through ultrasound guidance, we can see the nerve the majority of the time. It is very rare to cause an injury to that nerve. Hand pain after the procedure is not uncommon and can happen due to excessive swelling and excessive hand use. Elevation, ice, rest, and anti-inflammatories usually resolve the pain. It is very uncommon for someone to need a reoperation of the carpal tunnel. It can happen if your ligament heals very tight or if not all of the fibers of the ligament are released during the surgery. Another uncommon complication is bowstringing of the tendons in the hand. It can happen with heavy use of the hand before allowing the ligament to scar and keep the tendons inside the wrist. It is extremely rare. Let's talk about what to do after your minimally invasive carpal tunnel release. You will go home with painkillers and a waterproof dressing. You must not get your wrist wet for the first week. I would recommend you wear a splint to reduce your movements and to protect the surgical wound. Dr. Tom will see you in a week's time where he will change the dressings and organize a post-operative scan of your wrist. If you have any questions, contact the practice or Dr. Tom on his mobile. You will be discharged with post-operative instructions and pain prescriptions. Try to keep your hand elevated for a day or two and prop it on pillows when lying down. Wiggle your fingers and open and close your hand frequently to encourage circulation. Normal activities can be started as long as they do not cause your wrist to be sore. You should not drive home on the day of your procedure and until you can comfortably use the controls. The local anesthetic will produce numbness in your hand that will probably last for about 4 hours. Dr. Silva will generally call you or text in a few days to see how you are going. Please contact us if you have any of the following: a temperature, pain that is not controlled by mild painkiller, coolness and color changes in your fingertips, continuing ooze from your wound. I hope this gives you a good idea of what to expect. Thanks for watching and see you soon. Thank you for watching, and I hope this video made your process of understanding the potential complications a bit easier. Dr. Tom Silva will be seeing you again and going through any questions you might have. I wish you the best, and I bet you can't wait to get better.